Function with Purpose Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 9, Episode 2 of the Function with Purpose podcast. Thank you for joining in, everybody. I definitely appreciate it. This is Dr. Amy, and welcome. If this is a first-time listener, definitely subscribe, and know that these podcasts also are cross-posts to the Fortress Physical Therapy YouTube channel. That channel, I have been working on that and building it over the past 3 years, trying to put some good resources out there, both from the patient perspective and from the physical therapist perspective. But go ahead and subscribe to that channel as well. I would appreciate it, and I'll put that link in the comments below. So, Episode 2 of Season 9. I want to talk about this. Today's title is going to be Elective Surgery versus Emergency Surgery. So the differences. There's for sure a major difference between these two types of surgery, I guess, subjects or surgery protocols, I guess if you want to call it that. And these are my own definitions that I came up with, and I'll kind of provide you with some examples. So, first and foremost, when we do talk about the elective surgery, which we'll talk about first, I think it's super important to try out or attain and make physical therapy a part of that process first. Physical therapy should become the first go-to route before any elective surgery. Okay? Keep that in your mind as I'm kind of explaining this. Okay, so first and foremost, we're going to talk about elective surgery. Some examples that I'm going to provide in my own definition of elective surgery. So typically these surgeries or surgical procedures usually are less invasive, I guess, in nature. Sometimes they require local anesthesia, or maybe a particular surgery might be in a like an outpatient surgical center, so like a same-day surgery. So you have the surgery, then you're discharged the same day. But one of the big things when I was a little bit researching, like, what is elective surgery? It totally makes sense, right? Because you are actually scheduling, you, the patient, interacting with the administration. You are scheduling this particular elective surgery in advance. It's like you're putting it on your calendar, just like how you schedule your dentist, just like how you schedule your, eye doctor appointments, right? Your yearly annual, just like how you schedule your physical every year. It is elective. You are electing to go into surgery. Most of the time, these type of surgeries can be non-medical, right? So some examples may be a total knee replacement or a total hip replacement. Or maybe it's a superficial skin cell resection. Very commonly the skin experiences like a basal cell carcinoma type deal. Those are not really life-threatening to the body, but they're definitely something that we need to take care of. So that's an elective surgery, right? And even a rotator cuff repair or nerve ablations, those are elective surgeries. Another prime example would be like a breast reduction or a breast enhancement. Breast implants, right? That is elective. So think about these examples and what I just mentioned like 2 minutes ago. Has one even tried physical therapy prior to their elective surgery? Now, more specifically, like the examples I gave, like a total knee replacement, a nerve ablation, that's actually quite common for like headaches, or a rotator cuff repair. Have you even tried physical therapy first? Because there's a lot of research out there. If there's musculoskeletal issues that one sustains, physical therapy is a better route than elective surgery. Your outcomes are going to be better. But I think the caveat is you have to put in the work to get yourself better in order to avoid surgery. And it takes time. Whatever type of issue there is, the timeline of healing and getting better is different. You know, a knee replacement, commonly caused by an arthritic joint, arthritis buildup in the medial compartment of the knee or the inside of the knee, versus maybe chronic headaches, nerve ablation, like typically a neurologist or a neurosurgeon. You know, it's medicine, take this other medicine, maybe get a physical therapy, maybe go see a chiropractor, I don't know. Come back, see me, let's see if the medicine works. If not, all right, let's just like sever your nerves, C1, C2, that go into the head and that nerve distribution. No, people. Okay? So these type of elective surgeries aren't necessarily necessary. Are they truly necessary? Have you tried anything else prior to electively going down the elective surgery route? So those are some questions to kind of ask yourself. But now, flip side, well, what's emergency surgery, Amy? Like, you know, what's about that? And like, should physical therapy be tried first before that? No. Answer that question, no, because of the word emergency, right? So my definition of an emergency surgery is an immediate surgical procedure that must be performed in order to preserve one's life. It is not a scheduled out surgery. It must occur immediately without a scheduled notice, right? So a prime example, maybe someone needs to get cardiac stents put in because they just had a heart attack, right? And their arteries are clogged in their heart. That is emergency surgery. Oh my gosh, we have to put stents in to open up that blood flow to get to the heart. So if you don't have blood into the heart, guess what? Bye-bye, right? We don't want that. That is a life-threatening issue. Another example, an appendectomy, which means removal of the appendix. One of my coaches had this a couple years ago. He was experiencing lower right quadrant, lower right ab pain, severe pain. He couldn't even stand up. He had to be bent over the whole time. And he's like, what the hell? What is going on? Like, it feels like food poisoning. I don't know what's going on. Well, it got worse, so what did he do? He took his ass to the emergency room. They were like, holy cow, your appendix is on fire. If we wait any longer, this can lead to sepsis. So he had to get his appendix removed ASAP. Right? And another good example that I'll throw in there is sepsis, right? So sepsis just means an infection of the entire body. We don't want that, right? And then also another prime example could be like brain bleeds. You know, maybe someone falls, hits their head, and they're unconscious. Like that's emergency. Like, we need to get some scans done. Is there anything internally that's going on in the brain? Oh my gosh, there's a brain bleed. Holy cow, this is life-threatening. All right, that is an emergency surgery. Now, like I mentioned before at the beginning of this podcast, right? Emergency surgery. Usually you're not going to see a physical therapist first. I broke my arm. Oh, I better go see a physical therapist. Like, my arm's completely bent out of my skin. No, like, come on, people. You got to go to the emergency room for that, right? That is life-threatening. Now, after someone perhaps has a surgery, an emergency surgery, physical therapy, yeah, all for it. Even with an appendectomy. Oh, yeah, right? Because you are in an operating room under anesthesia, getting a little bit cut open, per se, for a removal of the appendix, but now I think they go through the belly button. So not super invasive, but like, you're in an actual operating room, like, legit, with a legit team of people, right? Like, and I'm not saying you're not that way in that type of atmosphere for an elective surgery, but physical therapy after an emergency surgery, yes. Yes, yes, yes. Physical therapy before an elective surgery, yes. Yes, yes, yes. And in fact, when we think about this, getting surgery in general is quite expensive, right? Elective surgeries can even be more expensive than emergency surgeries. So when push comes to shove, if I was the patient thinking about an elective surgery, hell yeah, I'm going to try out physical therapy. Hell yeah, I'm going to have a team of healthcare providers to prevent me walking down that surgical pathway. I'm not going to drop 50 grand on a total knee replacement if I can help myself. Heck no. Now, disclosure, everybody's different. But I want to give you and shed some light on this, the differences between elective surgery versus emergency surgery, and how physical therapy should be a part of both type of surgical routes. So, I'm going to leave you with this. I'm going to attach in the comments of this podcast. There's a cool podcast that this group of physios, they're called Ice Physio 2.0. Awesome group of people. There's this podcast, I believe it's number 1444, and it's titled Stop Getting Surgery, or something like that. And take a listen to it. Trust me, it's going to be like the best 28 minutes, one of the best 28 minutes, besides listening to me, that you'll ever listen to. And it is awesome. Dr. Allen just like puts it out there. He's a straightforward dude. So I'm going to drop that in the comments as well, and that will give you even some more perspective. All right? So, yeah. Elective surgery versus emergency surgery. Difference. Elective primarily is scheduled in advance, while emergency, it just kind of pops up, right? It is a life-threatening concern. And yes, physical therapy should be a part of both processes. Physical therapy before elective surgery, so we can prevent choosing to get surgery, right? In physical therapy after emergency surgery, so we can rehab and get you back to doing the things that you love faster. That's a wrap for today's episode, Function with Purpose podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.